Well, hello, everyone, and welcome to the third edition of TechScan's Tech Talk series, Candid Conversations with Key Dental Influencers. Today, we're talking with Dr. Neal Patel of Infinite Smiles Dentistry based in Ohio. A brief introduction to Dr. Neal Patel. He has dedicated his career to educating himself and teaching others high-tech dental products like 3D CBCT, intraoral scanning, biometric products like T-Scan, and Neal is actually Dentsply Sirona's highest rated and youngest speaker qualified to teach their advanced training seminars. So he is full of so much knowledge when it comes to technology and dentistry. And that's going to be the focus of our interview today. Before we begin, I'd just like to mention some information about Zoom webinar. So if you experience any problems with your audio, I recommend that you disable your computer audio and reconnect via your telephone line. This is being recorded and will be available shortly after the interview as well. We'll take questions at the end of the interview, so please submit these in the Q&A panel in Zoom webinar. So with all of that, welcome to all of you, and thank you for being here, Neal.
Thank you for having me, Jennifer.
Yeah, so it's great to connect in with you again. I remember, it's probably been well over 10 years since we first were working together, and that's when everything was really starting to go digital. We were at the forefront of a lot of those developments. So yeah, thanks so much for joining. The first question that I really have is, for someone that is normally practicing full-time, traveling to lecture all over the place, what have you been up to these last 6 to 8 months? And, what are you hearing from colleagues around the dental industry?
It's been an absolutely train wreck of a year for all people around the world. And I'm happy to say that I'm proud of dentistry as a whole. I think we've all been really faced with some big challenges. Some of us have been mandated to be shut down due to the health scare of COVID-19. And I think we've managed the situation as best as possible. So I've heard just about all kinds of stories, anything from clinicians who are struggling to keep their doors open to clinicians who are crushing their goals. And then obviously everything in between those two parameters. Through the last 6 to 8 months, I would tell you that I've really honed in on focusing on the one thing that I can control. That is my practice and my dentistry, because everything else is outside of my control. But one thing that I've come to realize is patient demand is a constant, and sometimes it'll ebb and flow. But the reality is there's pent up demand for those that have noticed a pinch in their schedules, but that pent up demand will come back, and the dentistry is there. And I can tell you that fear is something that all of us have. Regarding the health of our practices, the business revenues, managing a clinical team that we've worked so hard to acquire and train, the fear of losing all of that is real. But now is the time to actually sharpen your claws. Now is the time to dig deep, because this is what's going to make or break you. And for those of you who think that just sitting back and not pushing forward is the key, waiting for the dust to settle, I believe you're firmly mistaken. The dust will settle, but those that rise to the top will be the ones that dug deep, that sharpened their instruments, and realized that this is an ideal opportunity to hit the reset button within our practices. And my message for those of you that are trying to figure out what the next year or 2 or 3 looks like, I think this is a great opportunity for all of us to take a step back and realize that we get too familiar with our surroundings. Take me, for example. Jen, my practice. 13 years ago, I invested in some technologies that people thought I was ridiculous for doing so. In fact, I put everything on the line, right? And some of these technologies—
That's why I wanted to talk to you.
on the forefront. And it was a huge leap of faith, and the risk was incredible. But I survived it. And having been through that process, I can tell you one thing. We have to push forward and maintain our level of technology, because that's the one thing that can carry us into the future. Our patients will always have a need for dentistry, but they are becoming exquisitely selective on who they have their dentistry done by and how the dentistry is done. They have a fine-tuned appreciation for quality dentistry, and they are absolutely interested in having advanced technology in how dentistry is done for their own mouths.
Mhm.
And the reason I say that is because patients, consumers around the world, no matter what the circumstances, are always looking at technology. And I think this might be overused to some degree, but I see patients who walk in with a brand new iPhone. Every time I see them, every year or every 6 months, depending on how often they visit my practice, they've always got the latest iPhone. Okay.
Mhm.
And as dentists, I think it's certainly a much different level. When we invest in technology for our practices, it's several zeros larger in terms of cost to our practice. But the same holds true for our practices. We need to maintain a certain level of progressiveness when it comes to maintaining technology and to stay ahead of the curve, because the technology is changing so quickly. For those of you who think, oh, well, I'm just going to wait 2 or 3 years or 5 years for this technology to cost less because it will become more replete in the industry, you're mistaken, because when that new technology or that technology is cheaper, more cost effective, the level of advancement that that technology would requires years of education and years of experience to utilize. And if you feel that you can jump right into it without all of these years of getting acquainted with what's available currently and then jumping into the technology that's available 5 years from now, you're mistaken. It's going to be a challenge. You have to maintain a certain level of knowledge base clinically and in business and certainly in technology, because it is changing rapidly. And it's not going to be easy for someone to jump into it cold turkey in 5 years. So my message is to consider upgrading your offices, regardless of what technology that is, whether it's digital x-rays, whether it's cone beam CT imaging,
Mhm.
intraoral impressions, biometric equipment such as tech scan, lasers, whatever it is. Now is the time to reinvest in the practice. Now is the time to reinvest in your education. Now is the time to push harder when you least expect it. Because when that flood comes, because there will be a flood of patients who need dental work, you'll have something new in your tool belt to apply to their needs. And you'll be able to help them that much better, but build your practice that much faster. And all of the unnecessary stress that we put ourselves through this past year will magically get erased, I promise. So that's what I did for the past 6 to 8 months. I actually reinvested in my practice and invested in some new technologies, including more robust milling technologies for my lab.
Yeah.
I invested in a new cone beam from Dentsply Sirona. I invested in a new tech scan. I had the same one for years. And thank you for
Yeah.
connecting the dots for me,
Yeah.
Jennifer. I have a new tech scan. So all of these things are really important to keep our skill set sharp and honed in on what we do best.
Cool. I think that's a really strong and clear message for people that I think is really important. So when you talk about the process that you went through and when you first started practicing and you embraced all this technology, would you recommend that same path to dentists that are just starting out? So is it realistic that a new dentist, so this is specific to new dentists, is it realistic that they can both build their practice and invest in technology to help them?
Yeah, that's a fantastic question. Um, I firmly believe in the skill set of a dentist to adopt technology, but one thing is we have to be very clear. When you invest in technology, you can't just simply expect to plug it in and have it work magic. You have to dedicate yourself to that technology. You have to invest in your own education, and you have to push that technology and implement it the way that specific technology was designed to be implemented. So I often see clinicians who will invest, for example, in a cone beam or a CAD CAM technology
Mm.
and assume that because they're a dentist, that it'll automatically work for them. And they're gravely mistaken. to actually take advantage of a technology, it's more than just investing in it and plugging it in. You have to implement it into your workflow. You have to implement it into your daily practice, and you have to educate yourself and your team on how to implement, how to take advantage of its features. So I do think that for new dentists who are just getting into dentistry, my recommendation is if you think that you are willing to take that to that level, meaning to educate yourself and dedicate your time and energy into learning something new, then you should absolutely invest in technology, no matter what it is. And in particular, I think that you have to have a thick stomach because it is not an easy thing to swallow when you see the numbers behind some of these technologies. But if I can tell you that it's worth the leap of faith, because if you survive that process, that rigor, that intense dedication to focus in and really educate and implement technology into your workflow, you'll break through at a much higher level clinically, you'll break through at a much higher level in business, and your patients will absolutely recognize that. And that is how you grow a practice. If you think you're going to be better tomorrow or next week or next month simply by doing exactly what you were doing yesterday,
Not the case.
you've got to adapt. You've got to push forward because other practices are doing so. You're gonna get left in the dust, in my opinion, if you think that you can wait or choose to wait until a later point in time. It's a constant.
Yeah, I think that's a great. We have a lot of younger dentists that are drawn towards these digital technologies, and
Absolutely, and
you
actually
know,
better
yeah,
suited for it because when I went to dental school, we barely had the technology that's available to us in the market today. These
right.
younger dentists fortunately had a much better experience in their journey when it comes to computers, when it comes to iPhones, when it comes to technology in dental school.
It's
So
like the expectation.
absolutely, they're better suited for it. So you know what? Take advantage of that
Yeah.
because some of us who aren't as blessed having that
Maybe the
opportunity,
path has been harder for, yeah.
harder for us to do it than for them. So they should do it.
Yeah.
Absolutely. And what's the worst that can happen, Jennifer? Let's assume this. Let's assume that the worst is that you overstep your means. You invest in a technology that's beyond your capacity to actually financially afford that technology.
Mhm.
I would beg to differ anyone that says that you can easily fail. You will still be able to do dentistry.
Mhm.
Easier to make these mistakes when you're younger than when you're further along your journey and
Totally.
have a practice that doesn't accommodate technology. You got to do it while you're young, and it's okay to fail because that's how you grow stronger and that's how you learn. The one thing someone can't take away from you is your ability to perform dentistry. And so
Totally.
you have to take a leap of faith sometimes, and that's the only way you'll know is through that challenge that you can actually break through and do it.
So what is it that these technologies, you mentioned that obviously patients are going to be drawn to practices that have more advances in technologies, but what is it that these technologies allow you to do in your practice now that you've learned them, you've become an expert on them, that you can't do without them?
It's a convenience for my patients.
Mhm.
So when technology is implemented correctly into a practice, the patients feel and notice the difference in the quality of care that they get, but also the time with which it's done.
Mhm.
Today, in my humble opinion, I have very few patients who are shopping from a price standpoint.
Mhm.
Today, what they're looking for is efficiency.
Mhm.
And I think that we can all appreciate this. A good friend of mine, Tarun, actually used this analogy. As a dentist, if I had a clinical team member come to me and tell me that they had to get a specific procedure done, whether it be a dental procedure or a medical procedure, and it took 6 to 7 visits, for example, for a traditional implant,
Mhm.
just one implant, 6 to 7 visits to go visit a specialist to have that implant addressed from start to finish, and that they needed to actually take 6 half days off of work to allow that to happen because the specialist only works Monday through Thursday.
Mm-hmm.
and they are limited hours. They like to shut down at 3 o'clock. So if a hygienist of mine needed an implant and they needed to go to a specialist and requested 6 to 7 half days off of work, I don't know if I would allow that. I really don't, because I have a business at the end of the day that I have to actually run
Yeah.
as well, right?
Mm-hmm.
So we have to also put ourselves in the perspective of the patient. Today, we can deliver implant therapy in 2 visits, where with technologies such as cone beam and CAD CAM and tech scan, we can design a restoration in advance, use guided surgery to place an implant exactly where it was planned so that the prosthetic fits exactly from a timing and a rotational standpoint.
Mm-hmm.
And then use tools like tech scan to ensure that the occlusion is accurate
Mm-hmm.
to allow that implant to properly integrate. There's a concept called one implant, one time. And we have data that suggests that here in the near future, being able to actually remove a tooth, place an implant, and put the final prosthetic for a single tooth is something that we can actually look forward to. Okay.
Very cool.
So
So is
now
it,
all of a sudden, a patient who was balking at the cost is now realizing that 6 to 7 half days condensed down to 1 visit or 2 visits is actually worth the expense because it requires much less time out of their work and it allows them to accommodate that in their busy schedules. So it's about time and efficiency.
mm. And I
Patient,
think if they were getting a second opinion or something, they're going to notice like, well, why isn't my dentist able to do that? You know what I mean? Why aren't you using this then if you could do this for me?
absolutely. So
Yeah.
when we get a second opinion consult, we take the time to educate our patients using that technology. So we'll take a cone beam, we'll take an intraoral scan with a
Mhm.
CAD CAM scanner. We'll design a virtual prosthetic that's customized to the patient and overlay it within the software so that we can actually show them exactly where the implant goes, what the tooth looks like, and the sophistication of that process, but how we simplify it in 1 visit. I would beg anyone to try to challenge us on finding a solution that's more appealing to a patient than that workflow. And the beauty of this is I can teach that workflow to all of your customers, to all of the doctors around the world, because it's that easy.
Mm.
And that's what I'm talking about. It's not just about buying the cone beam and then using it when you are desperate, when something doesn't go right, and then taking a scan to see what happened wrong. It's using it before you engage in dentistry, how
Mm-hmm.
you conduct the dentistry. Similarly, tech scan, when it comes to occlusion, I have a philosophy of wanting to use it during the treatment as opposed to after the fact.
Mm-hmm.
Right? So fine tuning and finessing our occlusion is not something that we have to deal with as an afterthought. Perhaps we can use it during the process of treating a patient to fine tune that so that we don't have to get into a situation where the patient's having a malocclusion and the resulting sequelae of pain and discomfort, and then using tech scan to figure out what's causing it.
Mm-hmm.
Sometimes we can use technology and should be using technology as part of the treatment as opposed to an afterthought.
Totally agree with that. So when we talk to dentists and they're hesitant to invest in the technology. So as manufacturers, often dentists have a list of things that they want to purchase and, they kind of fluctuates. Okay, this gets moved up a little bit, this gets here. But what do you think is the driving force behind someone either investing in or choosing not to invest in a certain technology?
I think it's a complicated answer, but I think that it has a lot to do with the health of the practice.
Mm-hmm.
I think it has a lot to do with the team members that doctor has brought on to support them in their journey for doing dentistry.
Mm-hmm.
And it has a lot to do with their advisors. In 2020, all dentists that are in the United States practicing should have been advised by their accountants to realize that Section 179 is a 100% write-off. Okay, that technology has to be installed and implemented before year end.
Mm-hmm.
100% write-off. Now, if your accountant hasn't advised you of that, you need to start asking questions as to whether that's the right advisor for you.
Right.
Because it makes no sense for that money to go into tax when it could be completely offset by investing it in technology, which absolutely helps the practice from a marketing standpoint. It could be technology, Jennifer, that honestly doesn't even work. Okay, because
Right.
there's technology in the dental industry that's foo-foo, right? We all know that.
Yeah.
But having the potential to market that technology, I think, is justification in terms of return on investment. So the reality is that we have to surround ourselves with advisors who understand the industry and what it takes to be cutting edge and to be progressive in this industry, to put your practice one step ahead of the practice that's right down the road.
Totally.
You always have to play that game, if you will, and
Hmm.
be ahead of the curve. And so I think that having been through this process and having touched base with so many practices that needed help in this country and around the world for that matter,
Hmm.
I think that the one thing that you can be sure of is that dentistry is going forward, and it's going to move forward whether you want to join them or not. And what I mean by that is these companies who develop these technologies see the potential that this industry has to offer.
Hmm.
And they're inviting all of us as dentists to join them on this journey. We just have to, as dentists, take that leap of faith. And sometimes we're going to fly, and sometimes we're going to fall on our knees. But we have to be able to get back up, brush our knees off, and take that leap of faith moving forward. So it's one of those things that we all have to deal with.
Yeah. Yeah. I appreciate that message. I think it's, yeah, I think it's really powerful because I think some people question, I think clinicians sometimes question, who's driving the changes in dentistry. And there's, a lot of manufacturers that are doing a lot of work, but ultimately the goal is what's better for the patient, right? Like those manufacturers have an idea of what the expectation is as well from patients' perspective. And
Absolutely.
so, yeah, I think that that's key. Okay, so what before we get into the Q&A section, because I know that's the part that people tend to enjoy. I've asked other people that we've spoken to on this as well. What are two pearls that you can pass on to those that are watching?
Um, I think the first pearl is to find balance. Some of us get really caught up with the nuances of dentistry. And by nature, dentists are very meticulous creatures. And sometimes we forget to look from a bird's eye perspective. So we get so fixated on the delicacy of what we do and looking at our margins under a magnifying scope or a microscope, if you will. But if you look to the side and you see a stack of ragged magazines and a Kleenex box and a patient mirror that has fingerprints all over it, you're missing the concept of what dentistry is all about.
Mhm.
You have to build an environment where patients are able to recognize the luxuries that dentistry has to offer. Because if you don't provide those luxuries, there is a dentist down the road who will.
Mhm.
There's no way you're going to be able to maintain your patient base with the pace with which many of these practices are progressing forward. So that's my first pearl. My second pearl is that you have to constantly educate yourself. Taking a CE just because we were told to take it, or taking it because we have to have so many hours to be able to renew our license, is the wrong approach. We all find ourselves in that similar 11th hour situation where we're looking for CE so we can renew our license. Okay, the reality is that we all have to deal with that, but you're missing the concept. Dentistry has so much to offer. There are so many great clinicians, even in your network, Jennifer, of
Mhm.
like-minded clinicians who are willing to share. Yeah, they're teaching, but they're willing to share.
Mhm.
They're
Absolutely.
willing to share concepts of dentistry and proven methodologies and clinical workflows that they themselves have utilized in their practices. And they're willing to share it so that other dentists don't have to make the mistakes that they made. You need to find a handful of dentists that you want to replicate their practice in your practice and grab onto them and get them to actually share their journey with you and educate yourself and push forward. But don't forget that you have to constantly do that. It doesn't settle in and at a point and say, oh, I've learned everything I need to know. We're constantly pushing new things, and so you have to maintain that level of knowledge base. So education is key.
I like that message of sharing education too, because I've noticed that even in the last 5 years, that people that are out there that are actively educating are a lot more willing to share. And especially now with, so much stuff happening online, I think that it's sort of like an open book of things, where before it was sort of like, no, you can't have my slides, no, you can't, do this. But I know from the beginning, you're like, nope, here's everything that I went through. You were always doing that. But now it's like, it's great to see others as well being so open to sharing.
We have
Um,
to share. I mean,
yeah,
look, here's the reality. Some people question what's the motive behind it. Oh, he must get paid behind the scenes to recommend these products. I don't.
yeah.
The reality is that when I'm able to share, I found that I get referrals. Okay.
Hmm.
So I'm being honest with your audience.
Yeah.
I get referrals, but I don't get the easy cases. I get the, oh my gosh, this didn't go as planned. We need your help. Can you bail
Right.
type of a discussion?
Hmm.
I love those challenges. I built my practice on challenging situations, challenging circumstances, and complex patients. If you want to take the easy ones, by all means take them.
Mm.
But that's the benefit of sharing, is that I get to share the do's, the don'ts, and my mistakes so that those of you who are listening to me don't have to replicate the same mistakes that I've made. But the benefit to me is really that when you realize there's a case that you just don't want to treat, many of us enjoy treating those kinds of cases.
Yeah.
So I'm selfish from that regard, but that's my benefit. Okay. So it's not financial. It's that I get to do the dentistry I love to do as a result of sharing my experiences.
Absolutely. Well, I appreciate all of your insight. I love your two pearls. Let's take a couple questions from the audience. So going off of the your point that you made about education, what education courses, they're asking specifically for CBCT, what education courses are currently going on? What does that look like right now? Is everything virtual? Are there in-person things going on? Just give us kind of a landscape. I think they're just looking for some, additional follow-up details.
Yeah, as it relates to CBCT, there isn't a one-stop shop. Okay, there are clinicians who are very well versed in cone beam technology from an experience standpoint, like myself, and then there's actual professors who teach radiology in cone beam. And I think that you have to be able to blend both to get a true perspective of what it's about.
Mhm.
If you go to see, for example, Dr. Don Tyndall, who is head of radiology at UNC at Chapel Hill, who's a good friend of mine, he's probably the best radiologist when it comes to teaching and being able to understand CBCT.
Mhm.
I would say that you're going to have a radiologist's perspective, right? But
Mhm.
the reality is that I'm a private practitioner, and what Dr. Tyndall sees at the university level may not be applicable in my private practice.
Mhm.
So you then have to find a private practitioner who's implemented that technology and is successful using that technology to then also give you information as to how to implement the workflows and integrate the technology and give you real world examples of what can be done using that technology. So it's a blend of both. So the reality is simple things that can be done. Many of the manufacturers of the specific technology that you're looking for can point you in the right direction because they work with these clinicians on a daily basis when it comes to beta testing and alpha testing and product improvement. So many of the technology companies will certainly guide you in the right direction. And I always say that that's a good starting point. But there are great resources online as well. Dental Town, I think, has been a fantastic resource for many clinicians. And there's so many of us who like to chime in and actually share without having to actually meet in person and with no skin involved, meaning no financial exchange of information. So the reality is that there's a great blend of opportunities out there. And there isn't one point person that's king of the hill when it comes to education.
Great. Yeah, I appreciate that. And hopefully that, I think that definitely answers the question there. This is specific to T-Scan, so I'll give a plug here and ask this one. We have doctors that use T-Scan for not just finishing their case, as you mentioned, using it kind of throughout the process, but also in patient education. They're asking if you use T-Scan for patient education, is there value to that? Or Is that something you aren't doing at this time? That's just kind of the question.
That's a great question. And if I have the freedom to be honest, I use it when it's specifically applicable in a patient who is suffering from malocclusion or TMD.
Mhm.
There are certain practices that, Jen, that you can obviously point out to the listeners
Absolutely.
that actually purely focus their entire practice on TekScan,
Mhm.
right? I'm not one of those practices. TekScan is a tool in my tool belt that I utilize when I need, given the patient's situation. So I do have some patients who come in with illicit symptoms of malocclusion, myalgia, muscle pain, tenderness in the joints, and I suspect it could be malocclusion that's causing all of that.
Mhm.
What better way or easier way to actually introduce that concept by showing them a digital map of the timing of their occlusion and
Mhm.
having them understand that it's a misalignment of how their teeth fit together.
Mhm.
During the consult, that's a prime example of doing that. And so, yeah, I do use it depending on the consult that
Yeah,
is.
that makes sense. Yeah,
So,
and I think a lot of our practices are that way too. I think we do have some that really focus on, focus on T-scan, but I would say that the vast majority of our users around the world, right, are clinicians that are doing, everyday dentistry and some advanced dentistry that, are using it at all different stages of, whatever the case is, but it's not like they're just a T-scan practice or something like that.
yeah, I will say that I do use it for the vast majority of my implant patients,
Yeah.
primarily because we all know as clinicians that the implants that we place and restore don't have the same proprioceptive capacity as a natural tooth. So although when we market with our registration devices and bite paper, for example, occlusal indicators, we can have an appreciation for physical contact, but we have no understanding of the power behind that contact and the
Right.
force that it's generating, or the timing for that matter. So for any implant patient, it is a must, an absolute must. And I think that it helps in the long-term prognosis of that implant. So it's not just to get it dialed in because that's what we told you need to do from a textbook standpoint, but it actually has an implication on the long-term health of that patient's restoration and that implant.
Absolutely. So the next question here is, how do you recommend someone prioritizes what technology to get in their practice first? Like, is there a phased approach or what are your?
No, I definitely have a phased approach. I think first and foremost, we have to find a cornerstone of the practice,
Mhm.
right? So some practitioners jump straight into robotic implant devices. So for example, a device, I won't name any manufacturers' names. Many clinicians are intrigued by a specific technology where a robot can help them place an implant. Okay,
Mhm.
and they focus on that, but they don't actually have a cone beam in their practice. Okay, so that doesn't make a lot of sense. So I think that from a clinical standpoint, the first thing that we owe our patients is the ability to properly diagnose. So I always start with x-rays, whether that's intraoral digital sensors
Mhm.
or a cone beam, which is the Rolls Royce of radiology and dentistry. That is a solid cornerstone off of which you will add additional technologies to build your empire,
Mhm.
right? So I think that cone beam is certainly a staple of a progressive and modern practice, but I'm able to then implement CAD CAM, lasers, robotic implant technology,
Mhm.
digital occlusal analysis, biometrics, and utilize all of that other data in conjunction with cone beam. So I can properly diagnose, I can properly treatment plan, and I
Mhm.
can properly educate my patients on their needs so that then I can actually do the dentistry I want to do, as opposed to the other way around where we have the ability to place an implant, but we don't have the ability to show a patient in their own scan where the implant's going to go and the nuances and the details.
Right.
So we don't want to be backwards from that perspective. We want to start it with technologies that help you diagnose and treatment plan, and then move forward and integrate newer technologies that build off of that foundation.
I think that makes a lot of sense. Yeah, and probably exactly what they were looking for in that answer. So thank you so much. I think this was great. I really appreciate your time and sharing your passions with us. we touched some on the T-scan technology during the interview today. I want to let everyone know that's in the audience that there are 4 workshops that are available to the audience for free and can be accessed with the with your enrollment in this series. If any questions come up during the interviews or workshops and you'd like to speak with us directly, you can reach out to us at 617-464-4500 or at info@tekscan.com. Thanks again, Neal, and everyone have a great night or a good day, depending on where you are in the world. There's people from all over the world on. So please join us as we continue with the rest of this Tech Talk series. And thanks again.
Thank you, TekScan.
We'll talk soon.
Bye-bye.